Okay, so tonight what we're going to talk about is stopping the cycle. So this is stopping the cycle of either emotional eating, binge eating, or whatever negative behavior you know that you've developed with food. So this is for people that know that they have an unhealthy attachment to food, and it's not just for hunger anymore. When I work with bariatric patients, and I have for the last 8 years, one of the things that I do is I divide into 4 categories the eating types that I've seen throughout the years. And I ask the person to tell me which one they most identify with. And some of them will identify with more than one, and that's okay too. And there's no right or wrong answer. So as you're, I know some of you guys are watching these to figure out what the psychological evaluation is all about. There is no wrong answer in terms of these things. The reason why I ask this, and probably why other psychologists ask this question in a similar form, is to figure out what unique factors are contributing to your weight gain. I've had people where I've interviewed and they're like, I don't know why I'm overweight. I think I eat steamed chicken and my broccoli and, I exercise 5 days a week. I'm not quite sure. It must be a metabolism thing. And those are the people that I worry about, because either A, they're lying, or B, they lack insight into what they need to fix. And both of those are problematic. So really developing insight into what has got me into this in the first place. So the 4 types are emotional eaters. So that's the one that people are most familiar with in terms of an unhealthy attachment to food. And it is what it sort of says on the tin. An emotional eater is someone that will use food for reasons other than hunger, usually related to some sort of emotional event. So it could be boredom, it could be stress, it could be connection, it could be a feeling of loneliness, anger, sadness. I've even had people use it for happiness, to celebrate. So it doesn't mean that you use food for every single emotion. It just means that you probably use food for some or certain emotions. And so the idea behind that is to figure out, okay, this is my type. I know that I eat when I'm bored, or I eat when I'm tired, or I eat when I am stressed out before an important meeting. So whatever that is, that if you identify with that, you are an emotional eater. And stay tuned to my other videos that I'm going to talk about, where I will expand more on the emotional eater and what to do about that. You can also tune to schoolofselfhelp.com. And I have self-help courses on there for people that are undergoing these surgeries that want the psychological component as well, where I really iron this stuff out. So this piece, though, in terms of stopping the cycle, is being able to gain insight, first of all, into what is getting us into trouble. So emotional eater is the first type. The second type of eater is a skip and binger, or sporadic eater. So this is the person that does not think about food until it's too late. So they will usually skip breakfast. They might even skip lunch. By the time they do eat, it's usually later in the day, and they are so ravenous by that point that they're sort of going for whatever's available. So fast food, vending machine foods, prepackaged foods that can sit on the shelves for years, things that we know are not good for us in terms of long-term health. So they eat a lot of food all at once, and then they're not hungry again for another period of 5 or 6 hours, and then they do it again. So it's this feast or famine dynamic that they're setting up with the body, and the body doesn't know what to do with the food once it gets it. The body thinks it's in starvation mode, so it holds on to it instead of burning the food. So that is also a problematic behavior. And a lot of these people, I find, the skip and bingers, usually will have a hectic work schedule, or they're taking care of kids throughout the day, and they're so busy that they're not thinking about eating until it's an overwhelming feeling. And then we never make good decisions when it's coming from this sort of carnal place. So I also find that these category of people will wait until they get home, 5 or 6 o'clock at night, and then that's when they sort of binge. And that also then becomes associated with, like, I'm home, I can relax. It's the demarcation of the end of the day. And so this eating in this bad pattern becomes even more reinforced, because it signifies to the person that they're home and that they can relax. So this category also tends to consume most of their daily calories between 6 and 10 p.m., which we know is not a good thing. And guess what? When you eat late at night, you're not hungry in the morning, so the pattern continues. So I will be also in the next couple videos talking about the skip and binger and what you can do for that. Or you can also tune to schoolofselfhelp.com for more information on that. The third type of eater is a food addict. This is someone that usually has a significant amount of weight to lose. So we're talking, 300 or 400 pounds. There is usually some significant trauma early in life, either physical or sexual abuse. And usually there is some other history of addiction. So it could be drugs, it could be gambling, it could be sex, could be alcohol, could be pills. But usually the food addict they're sort of an addict by nature. So they've worked programs, they've done AA, they're doing OA, they're familiar with it, and they know that there's this sort of addictive type quality or nature to them where there is no gray area. It's either they're perfect on a diet or they're bad and they're off and they're eating whatever they want whenever they want. And the food addict feels out of control, almost like an alcoholic would feel out of control. So they could be eating a meal and still thinking about what they're going to have later. They could be, out to celebrate something and still thinking about, what should we do for breakfast in the morning? So there's that constant need for food and to know that it's going to be there. And that signifies that food is serving some other purpose at that point beyond hunger, satisfaction, that there is some sort of emotional attachment that this person has developed or a security blanket that this food is providing for this person. Again, the food addict, I know people sort of joke and they're like, I'm a food addict or I'm a chocoholic, but I mean like a true food addict has a lot of addictive behaviors and usually a lot of trauma associated with the past. Fourth category is miscellaneous category. And this is for my people who they're just like, I don't really fit with any of those, but I just know overall my portion sizes are too big and I usually eat junk food. I don't eat that good of food. I've even had people that have said, you know what, I eat pretty healthy. I eat all organic food. I'm really, I like to cook healthy foods. I like to eat healthy, but I know I eat way too much of it. I'll clear my plate. Some of this is born out of the generations that people are coming from where their parents are like, they're starving children in Africa. That old adage, being able to, you've got to clean your plate before you can get out of the table. Whatever it is, there's usually this feeling of like, I don't want to waste the food. And the funny thing is, the food has already been wasted once it's on our plate. So do you want to waste it on your thighs, in your stomach, or do you want to waste it in the waste basket? So that is usually the most amenable to weight loss surgery, because that is the number one thing that the weight loss surgery intervenes on is the portion sizes. And so if that person has no other emotional attachment to food, they don't have, irregular eating habits like in the skip and binger category, and they don't have a lot of trauma or addiction, they just know that it's portion control. These are the people that tend to be the most successful with these types of surgeries because that is the very thing that weight loss surgery intervenes on. So this is all about just insight. So gaining insight into what type of eater you are, and then check out my other videos or schoolofselfhelp.com. I will go into more of each type of eater and sort of what we do, how we combat that. Okay? Thanks, guys.